Hello, my name is Dr. Lucy Wibbenmeyer. I am a burn surgeon at the University of Iowa's Burn Treatment Center. We know that leaving the hospital can be both an exciting and scary time. We have made this video series to help you with your burn and wound care while you are at home. Most of all, we want you to have a successful outcome, and we will be here to help you through this difficult time. The best way for us to keep you safe is to teach you how to change your dressings at home, how to properly wash your wounds, the importance of good nutrition, and how to keep your fragile new skin safe. The longer you are in the hospital, the higher your risk for problems such as infections. It is safe to go home, and we will make sure you get your questions answered. When you discharge from the hospital or leave after a clinic visit, we will send home care instructions with you. Even though there may be a lot of paperwork, please make sure you keep these handy in case you have questions or need to get a hold of us. The nurses may draw a picture to help you remember what dressings need to go where, like the ones shown here. The home care instructions will also include information about what to watch for as your wounds heal and information about how to protect your new skin from injury. It will be important for you or your caregiver to watch for signs of infection. The best time to do this is when you have the dressings off to shower and do wound care. Make sure you are in a room with good lighting so you can see if there is redness outside of the area of your burn or wound. You will need to look for the following: redness or warmth around the burn or wound, swelling that is new or different than when you were in the hospital, red streaking from the wound toward your heart, strong odor, bright green drainage on the dressings, if you have a fever higher than 100.4 degrees Fahrenheit that does not come down with the use of Tylenol or ibuprofen. Eating well is very important. Make sure you eat a well-balanced diet, including all food groups. High protein and high calorie foods help with healing. Some examples of these are meat, cheese, peanut butter, cream, butter, and jams. You may also consider liquid supplements to increase calories and protein. You should also drink plenty of fluids to help prevent constipation. Your new skin and healing skin is very fragile. It will not stand up to wear and tear of normal activity like your other skin areas. You will need to be very careful when you are in the sun for any length of time. Wear long-sleeved t-shirts, pants, or a large hat to protect your burn or wound areas. You will need to use sunscreen regularly because you are now at higher risk for sunburn to those areas. Apply sunscreen 30 minutes before going outside and reapply every 30 to 60 minutes. In the winter, you will need to be careful in cold temperatures. Wear heavy gloves and coats to prevent frostbite. Swelling can cause an increase in pain. To avoid this, elevate your injured areas whenever possible. If you are taking prescription medications for your pain control, you should not drive. As your wounds continue to heal, the amount of these medications you need will go down. We recommend taking your pain medicines about 30 to 45 minutes prior to doing your wound care and prior to all therapy appointments. Having medicines at these times will help these procedures be less painful. As a reminder, prescription pain medications can cause constipation. Take your stool softeners as directed and drink plenty of fluids to stay hydrated. High alcohol content and perfumed lotions can cause irritation, itching, and skin breakdown. We recommend non-perfumed lotions or mineral oil, and these should be applied several times a day. It will be important to keep your skin moisturized so that you are able to do your normal daily activities and therapies. If itching is a problem, please let us know so we can help you. As burns and wounds heal, the skin becomes tight. It will be important for you to follow the stretching and exercise instructions given to you by the therapy staff. If stretching and exercise are not done, you may have limited function or lose the use of those certain body parts. If this occurs, more surgeries will be required in the future. A scar continues to develop up to 18 months after an injury, so stretching will be very important for a long time. Everyone's skin heals differently. Not all patients require skin grafting, and some require multiple surgeries. You will have the best outcomes from your injury if you follow the instructions of the burn team. Please let us know if you do not understand something or if you have questions. It is normal for people to struggle with this type of injury. We are here to help you through this time and have lots of resources to use if needed. Please tell us if you are having problems with sleeping, nightmares, coping, or feelings of sadness. A counseling nurse or other burn team members can be available on clinic days by appointment. They can help you with coping strategies and help you find support systems near your home if needed. We would encourage you and your family to attend the Burn and Wound Survivors Group for ongoing support from people who have lived through what you are going through right now. If you notice any signs of infection, such as a change in the color of the wound from pink, red to either tan, brown, or black, or a change in the skin around the wound, or a healed wound that starts to reopen, or you have trouble coping, please call us at 319-356-2496 or toll free at 1-800-777-8442.